Good morning. Am I audible? Great. Morning to everyone. Good morning. We are starting our reading club with new book today. So we are starting with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना.
Good morning. Giving tribute to a great master, Dr. Samuel Hahnemann, for this wonderful divine science to all of us and who taught us dare to be wise, seeking always blessings from our Guru, Dr. Prafull Vijayakar, sirs, who made this divine science and bridges with the modern science to make homeopathy easy like mathematics. Thank you, sir. Jai Hanuman, Jai Homeopathy, Om Vijay Karayan. So, friends, we are in the journey of reading books since January 2024. So, up till now, we have covered four books from the Dr. Vijayakar sir's. So, the first book we have completed is the theory of separation. Then, second book, the modern science and homeopathy. The third book, end of my assumptions of miasm, and the fourth book we have completed is the verbatim. Now we are starting with one of the book, the best book ever, and which is very practical book for the neophytes as well as the learned homeopath. And today we are starting with the new books, that theory of acutes. It is nothing different from the concept, but the concept of the old principle has to be considered into one place, and then the applications of this principle in a very easy manner. That is what Dr. Vijayakar sir has made it for all of us. Before going to read our theory of separations, we have reading the organon of medicine, the wisdom of Dr. Samuel Hahnemann. So up till now in organon of medicines, we have covered the first 70 aphorism of the theoretical part, followed by we have completed the understanding of the disease part from the organon of medicines. And now we are reading the understanding of the medicines and how the medicine act and how the proving has been started. So what Master Hahnemann has told us that I am the first to open up the path of proving, and that is what we are reading the aphorism from Organon of Medicine, 6th edition. So up till now we have covered 116 aphorism. So in this before aphorism, we have seen that the certain medicines produce actions which is primary actions, and in bargain to that, our vital force is giving rise to a secondary actions. So and exception to this, it was the narcotic medicines where the narcotic medicines produce alternating actions. This was up till now we have read. So in continuations of this, we are starting with the aphorism number 117. To the latter category belong the so-called idiosyncrasies, by which are mean peculiar corporeal constitutions which, although otherwise healthy, possesses a dispositions to be brought into a more or less morbid state by a certain things which seems to produce no impressions and no change in many other individuals. So idiosyncrasy is a type of persons who having a peculiar constitutions and which are easily affected by the certain things. So there are example has been given. So some few persons are apt to faint from the smell of the roses and to fall into many other morbid and sometimes dangerous states from the partaking of the mussels, crabs, or the row of the barbel from touching the leaves of some kind of the sumac. So here, this is something called as the reactions is out of control to its action. So sometimes we can categorize that this is what something that our body is so much so hypersensitive to certain things, and that may lead to the out of control reactions. So certain individual which was a idiosyncratic type of patients, and when our medicine is or a medicine has been proven to them, they may produce a variety of symptoms. But this inability to make an impression on everyone is the only apparent. For as two things are required for the production of these, as well as all the morbid alterations in the health, to wit, the inherent power of influencing substance and the capability of the vital force that animates the organism to be influenced by it. The obvious derangement of the health in and so-called idiosyncrasies cannot be laid on account of these peculiar constitutions alone, but they must also be ascribed to these things that produce them, in which must lie the power of making the same impressions on all human bodies, yet in such a manner that but a small number of healthy constitutions have a tendency to allow themselves to be brought into such an obvious morbid condition by them. So here what Master Hahnemann is telling that for actions of medicines, there is a two things is required: the power of medicines, producing certain alterations in the healthy human body, and again in return to that, our vital force has also a power to influence that substance and capability to fight against that influence power by the medicine. So that is what it is: a intermingled actions. So, and the medicine has the capacity to derange the health. So, in the idiosyncratic patients, this is what something that the medicine having a power that produce in idiosyncratic patients, that is the hello. Am I audible?
Yes, sir.
Yeah. Okay. Yeah, I think I. Hello.
So some echo coming.
Hello.
Audible, sir.
Yeah, okay, fine, fine.
हाँ
So in idiosyncratic patients, when the small number of the doses also given, it can produce a disease or it can produce a morbid phenomena. But if the medicine has possesses that power, that also is, yeah, I'm thinking that is the cracking of the voice. Hello. Now audio is audible, clear.
नहीं सर, क्रैकिंग आ रहा है, आवाज ब्रेक होके आ रहा है.
Ah, okay. I need to connect. Hello. Now everything is clear.
नहीं सर, अभी भी क्लियरिटी नहीं है, क्लियरिटी नहीं है.
सर सबका आवाज क्रैक हो रहा है, सिर्फ आपका नहीं।
Okay, okay, okay.
किसी ने सर अनम्यूट करके रखा है क्या, देखो.
સર થોડું થોડું વચ્ચે વચ્ચે ડિસ્ટર્બન્સ આવે છે.
Okay. Hello. Now clear?
હા સર.
Okay, fine. Check. Okay, okay, great. So now audible?
यस
Yes,
सर,
sir.
नाउ क्लियर
Yes,
क्लियर
sir.
एकदम.
Okay, fine, fine, great, great, great. Okay. So, whenever we are proving the medicines to the idiosyncratic patients, so what idiosyncratic patient is, they are very, very sensitive to a small doses or which we called as the power of possession. Or sometimes, if you prescribe a placebo to idiosyncratic patient, they also produce such kind of the what we called as a disease in that. So here we have to look for this again in newer understanding of this. This idiosyncrasy is something that it is the constitution which is more sensitive to this thing. So in our day-to-day practice, when we are learning these things, so we think that a certain patient comes to us and that patient is, if you are prescribing a placebo to them also, and they say that आपकी दवाई से ये हो गया, आपकी दवाई से ये हो रहा है. So that is something which we called as a hysterical kind of patient. So that this agent do actually make these impressions on every healthy body is shown by this, that when employed as a remedy, they render effectual homeopathic service to all sick persons as remedy for morbid symptoms similar to those they seems to be only capable of producing so-called idiosyncratic individuals. So we have also the certain remedies, which is something called as that remedy having the action to produce a such kind of idiosyncrasies. That means the hysterical symptoms into the healthy human body also. So that is what some remedies which we have learned, that the valeriana, then moscus, these are the remedy which is which we called as the hysterical or idiosyncratic remedy. So that is also helping produce the morbid symptom. This is what our newer understanding we are. Yes, TMB, we are learning this. So what footnote number 96 says, that thus the Princess Maria Porphyrognithia restored her brother, the Emperor Alexis, who suffered from the fainting, by sprinkling him with the rose water in the presence of his aunt Pixodius. This is the example was given, that the fainting from the sprinkling of the rose water. Even the rose water does not produce such kind of symptom, but this is what the idiosyncratic patient has. And Horstius shows the great benefit from the rose vinegar in cases of syncope. So this is what something that the rose vinegar has the capacity to produce the syncope, the same way the rose water produce a fainting in many of the idiosyncratic patients. So this is what our medicine possesses, the same power that it is produced in the idiosyncratic patients. So what Master Hahnemann is telling us, that every medicine exhibit a peculiar actions on the human frame which are not produced in exactly the same manner by any other medicinal substance of a different kind. So this is very, very PQR, that even a medicine has also individualization. That each and every medicine has a peculiar actions on the human brain. The same way, the human being also individually different genetically. The same way, the genesis of the medicines also different, and it produces a different symptoms in a different individual. So this is what not the same as a different medicinal substance. So that has to be taken into consideration. So in footnote number 97, they say that this fact was also pursued by the estimable A.V. Heller, who says in the Latin, but the meaning of that Latin that is like the vast diversity of the powers lies hidden in those very plants whose external appearance we have long known, but we have not yet discerned their soul and whatever heavenly quality they possess us. So, simple example I will give you. If we consider the sand, so if you see the sand does not contain any power and the qualities you can think of. But when you potentize the sand in the form of silica, and you understand that the silica soul power or the heavenly quality is it act directly into the autoimmune cases also. So that is what the A.V. Heller is telling us, that every medicine possesses a peculiar actions which is not exactly the same manner by the other medicinal substance of the different kind. So friends, we will continue our journey of organon reading as the wisdom of Master Hanuman telling us very great things to understand the case in this modern era, as well as applications of this organon principle to our practice that help us to deal with and cracking the cases of our day-to-day life. So now we are starting with the day one of the theory of acutes. This is the book written in 1999 by Dr. Prafull Vijayakar sir, to make this understanding that the first and foremost thing that every individual knows, that homeopathy is chosen as a second line of treatments, and it is mostly for the chronic conditions. Even though neophytes and the college students in past, they are told us or teach us that this medicine is not acting on the acutes, but this medicine is good for the chronic cases. And we also learn from the same manner. But it was Dr. Vijayakar sir who thought that if the principle is telling us that the homeopathy can give you a rapid, gentle, permanent relief in each and every case, why should not it be in the acute also? So this is what Dr. Vijayakar, who having a painstaking effort of the many years of the practice and who have made this chart for our understanding in an easy manner. So this is what we are reading today. So our journey of this reading is to understand how to apply this principle of the homeopathy in acute also. So this is what the flow chart in revised in 2009 by Dr. Vijayakar sir. Some of the remedies is added in this new chart. For example, in no change, previously it was a three remedy, the opium, natramur, and the silica. But later on, the three more remedies added: metcarb, magnure, and metsulf. In sleep overpowering, there is three medicines. Previously, it was opium, antimtard, and nux. But later on, the another medicine added is sulfur. So this is the few chart of acutes. But how this was something which was sir has devised, that the chart is governed by the activity of the individual. So the activity can be three types: of the decreased activity, the increased activity, or the no change. And the decreased activity is divided into two categories, that is the sleep overpowering or the dullness. The increased activity can be the physical activity increase, the mental activity increase, or the verbal activity increase. That is what the categories sir has made for all of us. And the no change has, that means there is no change in the activity. So this is what the chart. So all of you, yeah, we'll share this chart in the group, updated chart, so you can get this. So once you remember this chart and then you apply, so I must advise all of the practitioners to keep this chart on your table, print out it and put it on the tables so that you can always look at this chart and look at the remedy so that it is easy for you to prescribe in acute cases. Because in acute, there is a no time has to be lapsed for the repertorizations and everything. So you should be very well versed about this indications, and that if you apply this chart in a very easy manner so that you can put this chart in your table so that it will help you. So this is the second book proposed by Dr. Prafull Vijayakar sir in 1999. The first is the theory of separations and the second one is theory of acute. So we are starting with this where this book is dedicated to Sir's mother, Mrs. Mohini Vijayakar, Sir's paternal grandfather, Vaman Rao Vijayakar, and Sir's maternal grandfather, Mukund Thare. So, preface. So, every book has to be read from the preface. So, the preface gives you idea that what was the actual things in this book. So, what is the preface of this theory of acute? So, homeopath and homeopathy have taken a second seat for a long. In the bus of the medical science, it is the only science with a firm, unadulterated principles and the concrete philosophy as it is a base. None of the homeopathic principles are age-old, time-tested remedies have become obsolete. None of them has developed resistant strain to the virus or the human alike. They are as effective in a single dose as they were 250 years ago when they were discovered. All this persistency and consistency of homeopathic drugs and the result is despite a drastically changing world scenario and having no research advances done by any multi-million dollar multinational companies. So as we know that in the modern science, when we have a certain remedies or certain medicines like antibiotics. So in the era of the 1950s, the penicillin is one of the good remedy for the combating the bacteria and virus and everything, the great remedy. But in the era of these modern days, the penicillin is absolutely obsolete because of it has no use. There are many more remedies which I didn't name, but in the same way, the Nux vomica, which was proven 250 years ago, the same Nux vomica will work in today's era also. So this is what something that the far beyond the modern medicines, that it is the time-tested old age, even though there is no resistance to certain trace viruses or the human alike. So this is what the superiority of homeopathy is. This is in itself speaks a volume of the stability and the scientificness of the science called homeopathy. The other medical science who call themselves scientific sciences are busy redefining their principles in a multi-million dollar racket industries and laboratories which churn out newer and newer version of killer drugs supposed to kill the bacteria and viruses, of course, only to be discarded as dangerous and ineffective within decades of its inventions. So much for the scientificness. So as we also have experience in the COVID time, we have seen that in a COVID time, the first prescription was given that in the COVID, the remedy which was very effective is the SCQS. So you should prescribe every case with the SCQS, followed by a few days that SCQS is not working. Then another remedy has been prescribed, then the another remedy prescribed, and finally they said that Fabiflu is working, and then also Fabiflu is not also working. So this is something that the killer drug has been proposed, and there are a lot of injections also given, but it cannot help them. So this is what they said, that it is so scientific, but actually it is not like that. The sciences are still struggling to find a drug which can cure an allergies or a common cold in a real sense of term. Their superficial knowledge limit them to think of the human being as the conglomerations of the spare part, trying to treat the part and calling themselves a specialist and a super specialist. They are blissfully unaware of the dangerous connections. Knowing little about the mind-body connections, these so-called leaders Knowing little about the mind-body connections, this so-called leader of the knowledge have the nerve to criticize the holistic homeopathic science as unscientific, baseless, and mystic. This was in 1999 what Dr. Vijayakar has thought about. Who is responsible for this plight of homeopathy? None other than us, a homeopath. We don't practice the science as it should be on the seven cardinal principles. We don't follow the homeopathic parameters of improvement in a patient. For example, general, which are exactly opposite to the allopathic parameters. So our parameters of follow-up and the allopathic parameters of follow-ups are the different. So we have to judge the case according to our parameters also. We are not interested in the Harring's law of the cure. We are trying to please the satisfactions of other sciences presenting statistic in the concept of the disease. We are not taking risk of undertaking acute serious illnesses or the terminal illnesses all in our own. We are not trying to establish the scientific connections to our theory of similia similibus curanter. In short, we are not trying to put our foot down and say with the convictions we are the homeopath and we wish to differ. So this is what Dr. Vijayakar has faced, and he has written this. So this book I have written is an essay to the produce conviction in those homeopaths who are not fortunate enough to get result in acute and the serious cases. So even though in a many olden learned homeopath also, when they face the acute cases, they even advise the patient that go for the allopathic treatment because of they are not so convinced about the science, even though in the nowadays era. So this is what the sir is telling us. It is in conviction to those homeopaths and those who are not fortunate enough to get the result in acute and serious cases. If the book and the chart is followed strictly, this is what Dr. Vijayakar has written that if you follow this chart strictly, anybody can get result in such cases, and that too with the ideal one dose. Once they grow in the confidence, I am sure that they shall all prescribe holistically both in acute and a chronic illness. And this, I am sure, shall ring the death knell for those Hippocratic homeopathic leaders of the multi homeopathic patent frame. So, this is what the even criticism to the homeopath also that you are if you are not doing if you are a mongrel sect or if you are not doing the homeopathy with the principle of the homeopathy. So finally, a word of advice, dear friends. Remember our homeopathic motto, what Dr. Samuel Hahnemann said that order sapere, the dare to be wise and act accordingly. Since the future belongs to the homeopathy, as you all know, this was in 1999, and in this era, the future of homeopathy is after the COVID that the rise of homeopathy is very high. So the recent data says during the COVID that the 59% of the population chooses the homeopathy for that first line of the treatment. So in this span of these 5 years, the homeopathy has advanced so far. So that what Dr. Vijay says that the future belongs to the homeopathy. Come on, let's grow together to welcome the homeopathic millennium year 2000 plus. This is what 2000 and we are in the 2020-24. Forwards. This was the forward by Dr. Gajanan Vijayakar, the father of Dr. Prafull Vijayakar. So after the publications of his first book in homeopathy, The Predictive Homeopathy, The Theory of Separations, which gained immense popularity among the homeopathic world, my son Prafull, who has hardly any time to spare for his family and friends due to his busy clinical practice, has somehow found time to enrich the homeopathic world with his sparkling knowledge against all odds. My son Prafull's nature since childhood has stood him in a good stead. His inquisitiveness had led him to path not tread by many. His creativity, which won him in a praise in handcraft, has today helped him to create easier path now new theories and hypotheses. His obstinacy has made him to stand by his theories with conviction. His greed for knowledge has made him acquire sound knowledge of genetics, embryology, human biochemistry, physiology, medicine, and medica. Above all, his mischievous, cheerful, and jovial nature has helped him to make a light of boring subjects and situations. This second book, in which he has dealt with the acute disease and their management, will prove to be the boon to the practicing homeopath as well as the student who want to practice classical homeopathy with ease. So this is what the easy practice, a boon for the and easy practice. With this book, he has divulged all his secret of successful practice, and that is another quality of his which will benefit the homeopathic fraternity. I wish Dr. Prafull a grand success in his venture and pray to Almighty to help him to serve the ailing humanity by Dr. Vijayakar. So this is what something you have to understand. If you have a knowledge, I must advise all the homeopaths, even a younger one or the older one, if you have a knowledge and if you have gained something, you must have give it to your colleague, give it to your friends, give it to your fraternity, so that the nature will get back to you with the more and more knowledge. So this is what you have to give it. What Dr. Vijayakar says, sir says that I learn something and I share with my fraternity. So that is what Dr. Vijayakar is. Sharing is always caring. So actually we are now starting with the concepts. So here in this book, the part one consists of the philosophy of this book. The part two consists of the materia medica of this book, and the part three having the clinical hints. So we are starting with the part one, the chapter one. So in chapter one, there is the two things, the concept of old and the concept of new, and what is the old concept. So if we know something about it, then and then we can apply it into our practice. So the introductions. Whenever a homeopath, even a successful homeopath, encounter or come across the cases of pneumonia and the typhoid, they prefer to just refer the case to an allopathic physician. This is what something happening with all of us also. Unless and until we don't know about this theory, till that we are also doing the same. But now we can evolve and we learn from things so that we can change our mind and we can apply to this. So we came across the cases of pneumonia and a typhoid, they prefer to just refer the case to an allopathic physician. Most of the time, the reason forwarded is homeopathy is slow and active therapy. So this is what most of time this is the myth in our conceptions of a mind. It is mean for a chronic disease, not only for the emergency. You get the acute attack of this disease controlled by allopathic, and then will treat you to raise your immunity so that you don't get it again. This is the lame excuse given by so-called homeopath, and this is what exposes the limitations of those homeopath and not the homeopathy. So, sir always says it is the limitations of the homeopath, not the homeopathy. Remember, homeopathy is a complete science, hence the limitations and the scope of homeopathy is homeopath himself. The homeopath knowledge is what falter. If not, it is the application of his knowledge which is falter. So two things is there. The knowledge is at falter, or if not, then the applications of knowledge is the falter. So friends, you should correct your knowledge first and you should correct your applications of the knowledge. So whenever you are correcting yourself, then you will get the wonderful result in your practice also. So many materia medicas have been written on the therapeutics of the fever and acute disease, yet homeopaths find it difficult to get result in such cases. The reason may be many, but the main reason is the lawlessness. Means that all the seven cardinal principles of homeopathy are not applied, and the law like that of the Harry's law are bypassed. So if you learn this or if you apply this, then and then you will get the results. So what is the old concept and the new concept? The old concept is like the aconite for the fever, the podophyllum for the diarrhea. I called it an old concept because the 90% of the homeopathic physicians have been using it for the last 200 years. It is because of the wrong applications of the homeopathic principles while prescribing our remedies that we have not been able to get good results. Hence, we have reminded second to the allopathy. The new concept which I have proposed here is not actually the new concept, but the rejuvenations of the basic tenet of the homeopathy as preached by the masters, but not understood by many. So I have devised a simple way of arriving at the simillimum in the acute cases. It is nothing but the simplifications of the reaching the simillimum without violating the seven cardinal principle of the homeopathy. So whenever you are applying the cardinal principle, you will get the result anyhow. So it is the old concept and the wrong applications of the knowledge. In acute diseases, for example, fever, diarrhea, dysenteries, or abdominal pains, neuralgia have been up to date treated with as much panic as is proportionate to the severity and acuteness of the disease. I have been guilty of and party to the type of prescriptions prevailing in the majority of the homeopathic circle in the earlier years of my practice. So what homeopaths do? Fever, wear, and are treated on non-homeopathic principle with the homeopathic medicines like a Ferrum 3x or a 6x, Calimune 3x or the 6x, Natrimune 3x or a 6x, or the combinations of the aconite belladonna, Ferrum or Eucalyptus, China, etc. in 30 or 200 potency, or sometimes the Azadirachta, Baptisha, and Pyrogen, etc. in a mother tincture form repeated frequently. So this is what the concept of the practice, old practice. So diarrhea are treated with the podophyllum, aloes, gratiola, gambosia, veratrum, China, arsenic, protontic, and all this repeated every hour or 2 hours or a 3 hour, depending upon the mood of the homeopath or the fixed formula of the homeopath, a formula which he or she has had best result with, whether similar. So this is what something they are doing. But such prescriptions are the blind prescription. They never give result, certainly not satisfactory enough to boost anyone's moral. The fever go down, if at all, gradually from 103 degrees on the first day to the 102 degree on the second day to 99 degree on the third or fourth day, and normal on the fifth day. This bringing down of fever is certainly not homeopathic result. The fever gradually goes down because the acute infection has been exhausted itself and the patient has recovered by himself. So this is what sometimes the homeopath take a credit that I have given the medicine and within 5 days he was absolutely normal. The gradually fever went down. It is not because of the homeopathic medicine, because we know the homeopathy works rapid, gentle, and permanent in a way. The physician who take credit for this result, be it in fever or a diarrhea, is obvious of the fact or the ignorant of the fact that the tremendous weakness and the tiredness and the body ache or the joint pain or the loss of appetite which ensues is not a homeopathic result. So be in a mind whenever you are prescribing any medicines and the patient is telling the fever is gone, but sir, still weakness is there, body is there, the joint pain is there, or there is no desire to eat something. This is not the homeopathic result. So any amount of the explanations that the weakness is naturally going to be there because of the 4 days of the fever or a loss of vital fluid in a diarrhea, etc. This is what we are giving excuses. Is an excuse, especially when you see the glaring difference when the patient has been treated with the classical single dose therapy. In the first place, fever or diarrhea or a pain do not and should not take more than 12 hours or at the most 24 hours, be it a typhoid, be it a pneumonia, be it a urinary tract infections with 100 to 200 pus cells in the urine. Such number of pus cells comes to the zero in place of 3 days, a feat which any fourth generation antibiotic cannot perform. So this is what I am share. I will share a few cases in between for this result after in the next sessions also, so that you can learn that a pneumonia can be treated within 3 days. Urinary tract infections will be treated within 3 days, and no antibiotic has been prescribed, and all the pus cells and blood cells in the urine has been gone. So this is what homeopathy is. Secondly, the patient does not feel run down, weak, or tired despite of the high fever, nor does he lose his appetite for the food or a stamina to work. Even the patient with the Vidal test positive for a typhoid up to 350 units have been seen to go to the office and do normal work without being aware of the fact that they are suffering from the typhoid. And all this with fever responding to a single dose of the indicated remedy within 24 hours. Even the chest X-ray follow-up of the pneumonia shows a complete regressions of lesion within 3 to 5 days at the most of the indicated remedy of those. So this is what I will show you the case with the report also. Yeah. Whenever you are reading the pneumonia, in the pneumonia, it was written in the medical book that the pneumonia having a 4 stage, the stage of congestion, then the stage of the red hepatization, then the stage of the gray hepatization, then the resolution stage. So each stage lasting for the 4 to 7 days, and the pneumonia resolved from the 21 to 28 days naturally. But if you apply the homeopathic principle, and you will get the pneumonia resolved within 3 to 5 days. So I had a case I will share with you in a later session. A single dose, a classical homeopathic treatment overshadows the old multi-dose and multi-drug treatment by the miles. In the old concept, the doctor himself is not confident of the result. So it is the matter of the confidence in how to handle the acute patients with this chart. So this is what Dr. Vijayakar has given us the confidence by giving this chart of acute and apply it in our practice. In the new concept, doctor can predict by 9 a.m. and tomorrow you will be fit and go for the work. In the old concept, crutches of allopathies are often needed. So in the new concept, no crutches of allopathies are needed. In the old concept, none of the 7 cardinal principles are being respected except the principle of the drug dynamization. Obviously, since we are using the potency. In my new concept, none of the 7 cardinal homeopathic principle is violated. In old concept, Haring's law is seldom seen. In new concept, the Haring's law must be seen. So to understand the Haring's law, the sir has given the first book, Theory of Separations, and by understanding this theory of separation, we know that how to apply this knowledge into our practice. For example, the cough and fever gone, but slight coryza has to follow, followed by the sanguine itching on the skin. This is something that the Haring's law has been followed. So typhoid cures is never and should never be followed by the hair fall. This is not what it means by the exteriorization. So whenever the typhoid patient comes and they having a hair fall, that means the patient is going toward the suppression. The dysentery cure is never and should never be followed by the backache or the joint pain or the muscular pain. So it is something called the suppressions. So reason the hair roots are embedded deep into the dermis, the embryologically offshoot of the dermatomes, mesoderms. The muscles pain, back pain, and the joint pain means the inflammations of the synovial membrane or the bursa. These are the originated from the mesoderm, whereas the typhoid is enteritis, the inflammation of the intestine, the entera, and embryologically originate from the endoderm. So looking at the embryological origin, one can safely conclude that the disease has moved from endoderm to the mesoderm, which is definitely deeper in origins and more important. Hence, the alopecia after typhoid is suppression. Hence, the backache or a joint pain after typhoid or dysentery is the suppression. So this is what you have to keep in mind and seeing the Haring's law of cure. One can safely assume or presume that the each and every acute illness is, for example, also the Haring's law of cure has to be seen. And if you don't, dear homeopath, you are going wrong somewhere in your applications of the 7 cardinal principles. So this is what the compass, what Dr. Vijayakar is telling you. That if you apply the homeopathy and if you don't get Haring's law in a follow-up, then be alert to understand that your applications of knowledge is somewhere going wrong and you didn't get the exact Haring's law of cure. So in each and every cases you get the Haring's law of cure. Now the chapter 2 is consist of what is the definitions of the acute illnesses and the chart of effectiveness and the types of acute illnesses. So how the acute illness present to us in our practice. So by acute disease, we mean that any disease or illness which can disturb the health of the person's first and foremost thing is temporary. It is not the permanent. So in acute, everything is temporary in a negative way. This could be this could include high fevers, acute pains, or neuralgia, the acute infections, either bacterial, viral, or parasitical, and most of the illness are the self-limiting. So whenever you came across, you have a 3 type of the illness in acute. These are the acute infections, The second one is the indispositions, and the third one is the acute exacerbations of the chronic disease. So you have to categorize these things and what you have to do. So if you have the acute infection, the category A, the viral fever, the influenza, the tonsillitis, the sore throat, the typhoid, pneumonia, pneumonitis, lung abscess, the septicemia, food poisoning, infective diarrhea, dysentery, urinary tract infections, colic infections, and pleurisy. These are the acute infections. You will use the chart of acutes. Whenever the another condition which is called as the indisposition is a temporary change or adaptations of the or body to the environmental stressors, and it will go away. So in this cases of indisposition, you didn't require any of the treatment. You must prescribe the placebo, and by the time you tell the patient that you will get better by tomorrow, so the patient will be happy and you are also happy because you are knowing that it is indisposition. And the third category, that is which we called as the acute exacerbation of the chronic disease. It seems to be acute, but actually it is not acute. It is a chronic conditions, and it is what something outburst of the chronic into acute form. So this is something which we have the malaria, which we have ulcerative colitis, which we have epilepsies of recurrent origins, the pulmonary cough and the fever of the pulmonary cough. So these are the something which we call as the acute exacerbation of the chronic. So first and foremost criteria to differentiate our case with this category, that either patient is acute or a chronic. So if it is a acute, then you have to differentiate the three category. It is the indispositions, actual acute or acute exacerbation of the chronic disease. So if it is acute exacerbation of the chronic disease, go for the constitutional treatment. If it is indisposition, nothing to prescribe, just give a placebo and the patient will be fine. And if it is acute infections of a recent origins and it is in a temporary, like the viral fevers, influenza, tonsillitis, and everything, so in that case, use the chart of acute. So this is what first and foremost thing you have to categorize the three things. So the acute illness are of three types. The first is a non-recurring acute infection, that means acute diarrhea, dysentery, high fever, either viral, bacterial, or parasitical. For example, typhoid, influenza. It may include pneumonia, lung abscess, pleuritis, pleurisy, urinary tract infections, etc. Sir has given that if you need to treat a malaria, you need to give a constitutional remedy in malarial cases, and that is what you need to prescribe. Malaria cannot yield to these acute remedies. Okay, so this is what you have to keep in mind, even though it was written in the acute illness. Acute exacerbations of the chronic disease like asthma, pulmonary cross, chronic ulcerative colitis, relapsing malarial fever, or sometimes it is called as the epilepsy. Epilepsy seen as the acute exacerbations of the chronic disease. And the third category, that is the indispositions, likely the transient acidity, transient malaise, transient coryza, transient gastric upset due to some overeating or heavy food, or mild injuries or abrasions. All are self-limiting and do not require any treatment. So here in this category B group, means the acute exacerbation of the chronic disease should be strictly treated as a chronic case with a genetic constitutional minimum. It does not warrant an acute remedy. The acute flow chart present in this book should not be used to get result in such exacerbations. If used, it might give you a temporary ameliorations followed by aggravations of the disease, and it might also lead to the suppression. So this is what you have to keep in mind. Again, in yesterday's question answer session, I have shared the chart of asthma. So in acute exacerbation of the chronic disease, the chart of asthma, in cases of asthma, you can use the chart of asthma. Okay. So that is also made by Dr. Vijayakar sir. The category group A, in which is under the consideration here, the acute infections are the one which need acute treatment, and this acute treatment is misunderstood by the majority of the homeopath. Under the guise of the acute treatment, a lot of liberties are taken, and any medicine unrelated to the constitution is selected on the basis of just one or two symptoms and prescribed. The rule to remember is that any remedy which gets indicated in acute stage is bound to be mathematical relation with the genetic constitutional similitude. There is the rule. And for scientific terms, see the remedy relationship chart. So for example, we have idea that it was in a golden book also written that the belladonna is acute of the calcarea carb. So whenever the calcarea constitutions comes to you and having acute tonsil infections and having a violent effect and the patient having a redness and congestions and everything, so this indicating that the calcarea constitution goes into acute state as the belladonna. So that is what the rule is to it is in relation to the constitutional simile. That is what Dr. Vijayakar has proposed. So using the chart of acutes, we have to get the best result. So we have to understand the theory behind it. So using the chart of acute and how to get the best result, for the years, the young homeopaths have found it difficult to put into the practice the law of similar. The dilemma begins right from the basis of prescriptions where there is no uniformity as every homeopath interprets the law according to his own understanding. Some prescribe similimum based on the mind, some only on the PQRS, some only on the disease picture, and some only on the organ involved. And none of them represent man as a whole. Remember, as homeopath, we treat the man in disease, not the disease in man. As a homeopath, I am concerned with knowing that what type of a man or what constitution am I dealing with. For that, I would like to know how this peculiar constitution patient has behaved when attacked by the bacteria or a virus. For example, when you hit your first fist in wooden panel, glass panel, and thermocol, coin, or cotton mattresses, the reaction obtained by your hit in terms of noise or a behavior of the panel concern will make you aware of what material you are dealing with. Even when the blindfolded, you can understood that this is the different material is. Similar, the reaction shown by the patient to the disease or infection will tell a physician what constitution he is dealing with. So here the reactions is most important. What changes occur or do not occur in the organism constitution shall in the first place be reflected by the activities of the affected constitution. So when the constitution is affected by the trauma or when the constitution is affected by the acute illness, their system is affected and their activity is affected first. So that activity has to be counted as the first priority in the case. So here the activity is the most important aspect. What the activity is governed by our what we called as the power generating mitochondria mechanism by the ATPs. So in activity gives you a life, activity gives you a change. So this is what the whole thing is based on the activity. So why this whole chart is based on the activity? Because the act is called as the primary reflections of the life or a living being. So life means a change. Anything in this world which does not change at all is a death. So hence act or the actions represent the life. The speed and the type of actions are specific for the specific constitutions. For example, we know that the Calcarea carb, Barretta carb, Helleborus, Gelsemium, Cilicia, etc. have a slow activity. The speed is slow. So same way the disease also they suffer from the slow. On the other hand, the drug like a tarantula, mercurius, belladonna, nux vomica will have a fast speed. So same way the disease they suffer from having a fast speed also. And the agricus, stramonium, etc. will have a jerky or a gyratory action. So same way the disease also they suffer from the jerky and gyratory. Such different actions and the speed are projected by the different constitutions in the original healthy form, which albeit all homeopathic need to know and observe to become a successful homeopath. They also ought to observe the change, if any, in this activity when respective constitutions is affected. The new picture thus formed and it is known as the acute picture, which is no doubt in relation to the original constitutional pictures. Thus, if the opium genetical constitution suffer from the fever or dysentery, if it is affected by the stronger dynamic influence, it will bring about a temporary change in the basic constitutional picture in terms of the activity, thermal thrust, and will be giving rise to invariably a picture either of the aconite or of a tentim tart or of a belladonna or of a bryonia or of a Alzheimer's or of a nux vomica or of a nux moscata, which are in relation to the opium. This may occur if and only if opium picture changes, which is not a must. So this is what something you have to keep in mind always. So the concept of remedy relationship will help you in prescription of the acute. So whenever you are dealing with some chronic patient and suddenly he might get some acute disease, which is you have to intervene in the follow-up, then and then you can think of the remedy in relation to that, and that is what in from the acute chart. So you can get the wonderful result from this. This change in activity, thermal thrust, and the physical or the mental symptoms which are thrown out by the constitutions are basically compensatory in nature and is a natural effort by organism to provide immunity and restore the sick to the health. Hence, more often than not, the health is restored without the aid of any medicine, so homeopathic or allopathic. If such recovery does not take place, then and only then it calls for an intervention. So this is what keep in mind. If this disease is taken care by the body itself in acute form, whenever you are dealing with the chronic cases, and if the body is trying to throw out certain symptoms, and if you prescribe placebo and body is taking care of themselves, then no need to prescribe because it is a natural effort of organism to get the immune system restored. But if such a recovery does not take place, then and then you can require to intervene the case. So this is what keep in a mind. So what Kant always says that the one who is the best physician is the least prescriber. So this is those who prescribe the least medicine in their bucket, they are the best physicians. In homeopathy, our basic law of prescription and form means similia similibus curanter. Hence, the remedy required, if at all, shall be in keeping with our basic law of similimum to the acute totality, which of course should be based on the activity thermal generals like thirst and food and mental changes or the attitude and not only on the physical symptoms. The remedy chosen on those on these lines are so effective that they make us obey all the cardinal principle. It means not more than one remedy, one dose is required to take care of the typhoid or a malaria or a lung abscess or a UTI. Not only the principles are abided by, but also the present sight of Herring's law coming true each and every time is a bonanza received by the prescribers. Above all, the speed of recovery or the cure is like the effect of magical wand. The lung consolidation disappears within 3 days. The first cell count of the 100 to 200 HPF in a urine disappear within 3 days. The fever came down, be it a typhoid or malaria, within 24 hours, with a general sense of well-being and no subsequent weakness ensues. The patient gets his appetite back within 24 hours and resumes work the next day. So this is giving us that the criteria that you should take a follow-up within 24 hours in acute condition, and you can observe the patient that within 24 hours his general has to be improved and the Herring's law has to be seen in that. So that is what you have to take care of in acute conditions. To bring about such result, one has to prescribe, and as previously mentioned on the activity thermal thrust and mental, and which have changed. This is called as the activity thermal thrust and mental axis. So this is what sir has made this axis. It is being difficult to analyze for some, especially new homeopath. I have simplified the analysis in the form of flowchart so that you can easily understood in a better way. The flowchart starts with the activity, and this is further divided into three categories, that is activity increase, activity decrease, and there is no change. The second is every section is further divided into a thermal, that is a hot or a chilly group of drugs, and further the differentiation is done on the basis of thirsty or the thirstless to narrow down the number of the indicated remedy, and the zeroing down on the similimum is provided by the three short line descriptions of the every remedy in the chart as a remedy pointer. So if you get these 3 pointers in cases, then your remedy has to be ruled in. These remedy pointers form a triad of the important symptoms which are the base of the remedy. They have to be present in each and every case beside the thermojournal axis. These are given in the form of a triangle. A few more confirmatory points are also provided to ensure the remedy. Some of these have been evolved from the practical experience. The three-line Materia Medica picture of the more than 60 drugs have been provided in this Materia Medica section in this book. The journal provided in this book under the heading of the drugs are during the heat, fever, pain, etc. and may not be the same in the chronic picture of the drug. For example, Sina, Carbovage, Calica, Black acid, Bryonia are generally thirsty, but during fever become thirstless. Pulsatilla, Apis, which are basically thirstless, may become thirsty in acute. Some drugs like some drugs like sulfur, opium, antidote, arsenic may be both thirsty and thirstless. There are many drugs which may appear in more than one places in the chart, indicating that they should not be neglected even in other conditions also. So again, the activity thermal thirst chart has to be divided into following categories. That is selecting the activity thermal thirst chart, which we called as DCTL, dull, chilly, thirstless, DSTL, dull, hot, thirstless, DCT, dull, chilly, thirsty, DHT, dull, hot, thirsty. So this is what you have to categorize, and you can have idea that you have to have remember certain drugs by looking into chart. So I must request all of the practitioners keep this chart printed and kept on your table so that you can every time whenever you are seeing that you can get the remedy very easy. Okay, the mental charts, the mental, physical, and verbal. So here the activity plus hot and thirsty, activity hot and thirstless, and adding them as a mental state, the remedy pointers and the simillimum is ready. So this is what very easy to prescribe. So we conclude our today's sessions here, and from tomorrow we will continue with another chapter on the conscientious and diligence. Already I have taught many times in our sessions also, but still we are reading this book, so this is what very important our clinical practice also. Hope you enjoy the reading of these sessions and you enjoy the learnings. And after this, we will start with the practical point of view of how the acute applications of the acute chart in our day-to-day practice. So that we'll share with you that I will share the new chart with all of you, and also sharing with you a chart of asthma so that you can get the idea of this chart and apply this into your practice. So we will conclude our day today. So thank you so much. Thank you for being with us. We will continue our sessions from tomorrow. Thank you all. Thank you so much.